Have you ever woken up in the morning and felt like your mouth was so dry it almost hurt to swallow? Like your tongue is stuck to the roof of your mouth, your lips feel cracked, and the first thing you reach for, before even getting out of bed, is a glass of water? If that sounds familiar, you're not alone. A lot of people over 60 experience this every single morning, and most of the time, they shrug it off. They think, well, I guess this is just part of getting older. But what if I told you it's not? What if that dry mouth you feel every morning isn't just a small inconvenience, but actually your body trying to tell you something important? That's exactly what we're going to talk about today. We're going to walk through the 5 main causes of waking up with a dry mouth, and more importantly, what you can actually do about each one. Because in many cases, this is something you can improve or even fix once you understand what's behind it. Now, before we get into those causes, I want to take just a moment to explain why this matters more than most people think. You see, saliva, your natural mouth moisture, is not just there to make you comfortable. Your body produces about 1 to 1.5 liters of it every day, and it plays a big role in protecting your teeth, helping you swallow food, supporting digestion, and even fighting bacteria in your mouth. So when your mouth is dry, especially night after night, that's not something to ignore. Over time, it can lead to tooth decay, gum problems, trouble eating, and even infections. And here's the part that really catches people off guard. In most cases, dry mouth isn't the problem itself. It's a symptom, a signal, a clue that something else is going on underneath the surface. And for adults over 60, there are 5 main causes that come up again and again. Let's start with the first one, because this one surprises almost everyone when they hear it. A very common reason for waking up with a dry mouth is medication. Now think about this for a moment. How many medications are you currently taking? Maybe it's something for blood pressure, maybe something for sleep, maybe allergies, or mood, or bladder control. Here's what most people don't realize. Over 400 different medications, both prescription and over-the-counter, list dry mouth as a side effect. 400. That includes things like antihistamines, diuretics, antidepressants, certain heart medications, and even common sleep aids. And here's where it becomes even more important. As we get older, many of us are prescribed more than one medication. Sometimes 3, 4, or even 5 different ones at the same time. And when those medications combine, their side effects can stack up. So even if each one only causes a little dryness on its own, together they can significantly reduce your saliva, especially while you sleep. That's why you might go to bed feeling fine, but wake up feeling like your mouth has completely dried out overnight. I remember speaking with a gentleman named Robert who was in his early 70s. He told me he had been dealing with dry mouth every morning for over a year. He tried drinking more water, using lozenges, even switching toothpaste. Nothing seemed to help. When we sat down and looked at his medications, we noticed he had started a new allergy medication around the same time his symptoms began. On top of that, he was already taking something for blood pressure and a mild sleep aid. Once his doctor adjusted the timing of his medications and switched one of them to a different option, his morning dryness improved within a couple of weeks. And that's the key point here. If your dry mouth started around the same time you began a new medication or added another one to your routine, that connection is very likely not a coincidence. So what can you do about it? The first step is simple but very powerful. Take a few minutes and write down everything you're taking. Prescription medications, over-the-counter pills, supplements, everything. Then bring that list to your doctor or pharmacist and ask a very direct question. Could any of these be causing my dry mouth? You might be surprised at the answer. Sometimes it's not about stopping a medication, but adjusting the dose, switching to a similar option, or even just changing when you take it during the day so it doesn't affect you as much overnight. That one conversation can make a real difference. Now let's move into another cause, one that's a little less obvious, but potentially much more serious if it goes unnoticed. This has to do with how you breathe while you sleep. Most of us don't think about breathing at night. We assume it just happens naturally, and for many people, it does. But for millions of older adults, something else is happening without them even realizing it. Instead of breathing through the nose, they begin to breathe through the mouth while they sleep. And when that happens, saliva dries up quickly. Air moving in and out of the mouth all night long causes moisture to evaporate, leaving you with that dry, uncomfortable feeling by morning. Now, occasional mouth breathing can happen to anyone. Maybe you have a cold or your nose is congested. But if it's happening every night, there's often a deeper reason behind it. One of the most common is a condition called sleep apnea. This is where your airway partially, or sometimes completely, collapses while you're sleeping. When that happens, your body struggles to get enough air, and it often switches to mouth breathing as a backup. And here's what makes it tricky. Many people who have sleep apnea don't know they have it. They might think they're just snoring, or they might assume feeling tired during the day is just part of aging, but the signs are often there if you know what to look for. Loud snoring, waking up feeling unrefreshed even after a full night's sleep, or a partner noticing that you sometimes stop breathing briefly during the night. And of course, waking up with a dry mouth day after day. There was a woman I once heard about, Margaret, a retired teacher in her late 60s, who had been dealing with severe dry mouth every morning for years. She kept water by her bed. She tried mouth sprays. She even cut back on coffee, thinking that might be the cause. But nothing worked. It wasn't until her dentist noticed unusual tooth decay and asked more questions that things started to connect. Her husband mentioned that she often snored loudly and sometimes seemed to stop breathing for a few seconds at night. She was later tested and diagnosed with moderate sleep apnea. After starting treatment with a CPAP machine, something that helps keep the airway open during sleep, her dry mouth improved dramatically within weeks. And even more importantly, her overall health improved too. Her blood pressure, which had been slowly creeping up, began to stabilize. That's why this matters. Because in this case, dry mouth isn't just uncomfortable, it's a clue pointing to something that could affect your heart, your brain, and your long-term health. So if you've been waking up with a dry mouth and you also notice things like snoring, fatigue, or restless sleep, it may be worth bringing that up with your doctor. Even a simple sleep evaluation can give you answers you didn't know you needed, and sometimes, addressing the way you breathe at night can change not just how your mornings feel, but how your entire day unfolds. And one of those causes is something that affects millions of people quietly, often without clear warning signs until it has already been there for years. I'm talking about blood sugar, more specifically diabetes, both diagnosed and undiagnosed. Now you might be thinking, I don't have diabetes, or I would know if I had it. And for some people, that's true. But for many others, it develops slowly, almost silently, especially later in life. Here's what happens inside your body. When blood sugar levels are higher than they should be, your body tries to correct that imbalance. One of the ways it does this is by pulling fluid from your tissues to help dilute and remove the excess sugar through your kidneys. And when that happens, you lose more fluid than usual. That fluid has to come from somewhere. And one of the places it shows up is in your saliva. So as your body becomes more dehydrated from the inside, your mouth produces less saliva, especially at night when you're not drinking anything. That's why many people with elevated blood sugar wake up with a dry mouth, sometimes long before they're officially diagnosed with diabetes. And it doesn't always come alone. You might also notice that you're getting up more often during the night to use the bathroom. Maybe you feel more tired than usual, even on days when you've slept enough. Some people notice their vision gets a little blurry at times, or that small cuts and bruises take longer to heal. These things can seem unrelated at first, easy to brush off, but when they start to show up together, they form a pattern. I remember a woman named Linda, in her early 70s, who shared something very similar. She said her mornings had become uncomfortable because of dry mouth, but what bothered her more was how tired she felt throughout the day. She assumed it was just part of getting older, but when her doctor ran a simple blood test, it showed that her blood sugar had been running high for quite some time. Once she began managing it, with some dietary changes, light activity, and medication, she noticed something unexpected. Her dry mouth began to improve. That's because the root cause was being addressed. And here's something important to keep in mind. A large number of adults, especially over the age of 60, have diabetes or prediabetes without knowing it. It doesn't always come with dramatic symptoms in the early stages. Sometimes the signs are subtle, like waking up every morning with a dry mouth. So if you haven't had your blood sugar checked recently, it may be worth asking your doctor about it. A fasting glucose test or something called an A1C test can give a clear picture of what's been happening over the past few months. It's quick, simple, and in many cases, it provides answers that can help you take control of your health before things progress further. Now, there's another cause that sounds simple on the surface, but works a little differently in older adults than most people expect, and that's dehydration. You might be thinking, well, I drink water, I'm not dehydrated, and that might be true during the day. But the way our bodies handle thirst changes as we age. When we're younger, thirst is a strong signal. Your body tells you clearly when it needs water. You feel it, and you respond. But as we get older, that signal becomes weaker. Your body can be running low on fluids, and you may not feel thirsty at all. So instead of drinking because your body asks for it, you end up drinking only when it crosses your mind. And often, that's not enough to fully meet your body's needs. Over time, this can lead to a low-level, ongoing state of dehydration, not severe enough to send you to the hospital, but enough to affect how your body functions. And one of the first places that shows up is in your mouth, because saliva production depends heavily on your hydration levels. So if your body is even slightly low on fluids, your mouth may not produce enough saliva during the night, leaving you dry and uncomfortable by morning. I once spoke with a retired couple, both in their late 60s, who had very different habits when it came to water. The husband drank regularly throughout the day, always keeping a glass nearby. The wife, on the other hand, rarely felt thirsty and often forgot to drink unless she was eating. She was the one waking up with dry mouth every morning. Once she started spacing out her water intake during the day, just small amounts consistently, and adding a glass of water in the evening, her symptoms gradually improved. Not overnight, but steadily. And that's the key. Hydration isn't about drinking a large amount all at once. In fact, that can sometimes be uncomfortable or even disruptive to sleep if done too close to bedtime. Instead, it's about consistency, giving your body a steady supply of fluids throughout the day so it can maintain balance naturally. If you think about it, your body doesn't shut down at night. It continues working, repairing, restoring, maintaining. And it needs water to do that effectively. So if your body goes into the night already running a little low, it's no surprise that you wake up feeling the effects. A simple shift, like making water a regular part of your routine rather than something you wait to feel, can make a noticeable difference over time. And then there's one more cause that doesn't get talked about nearly as often as it should, partly because it's easy to overlook, and partly because its symptoms can be mistaken for normal aging. This one has to do with your immune system, specifically a condition called Sjogren's syndrome. Now, the name might sound unfamiliar, but the symptoms often are not. This is an autoimmune condition, which means the body's immune system mistakenly attacks its own healthy tissues. In this case, it targets the glands that produce moisture, especially your saliva and your tears. So people with this condition often experience persistent dry mouth, along with dry, irritated eyes that can feel gritty or uncomfortable. And because both of those symptoms are common as we age, they're often dismissed or treated separately without recognizing the underlying cause. But there are a few signs that can point towards something more. For example, if your dry mouth is ongoing and doesn't improve with hydration or changes in medication, if your eyes frequently feel dry or irritated, or if you've been dealing with unexplained fatigue or joint discomfort that doesn't quite make sense, those pieces together may be worth bringing up with your doctor. This condition is more common in women, especially after the age of 50 or 60, and like many autoimmune conditions, it can take time to diagnose if no one is looking for it. But once identified, there are ways to manage it and reduce the symptoms so they don't interfere as much with your daily life. And that's really what all of this comes down to. Understanding that these small, everyday symptoms, like waking up with a dry mouth, are often connected to something deeper. And when you start paying attention to those signals, you give yourself the chance to respond early, to make adjustments, and to improve not just how you feel in the morning, but how your body functions as a whole. Because sometimes the smallest discomfort is actually the beginning of a conversation your body is trying to have with you. And when you listen closely enough, you can start to take back control in ways that feel both simple and powerful at the same time. And once you start looking at it that way, as your body trying to communicate with you, something interesting happens. That dry mouth in the morning stops feeling like a random annoyance and starts to feel like a useful signal, a signal that you can actually do something about. Because the truth is, every one of the causes we've talked about, medications, breathing during sleep, blood sugar, hydration, even autoimmune conditions, can be addressed in some way. Not always overnight, not always perfectly, but step by step, in ways that are very manageable. So let's bring this into something practical, something you can start using right away. The first thing you can do is take a closer look at your medications, not in a complicated way. Just sit down for a few minutes and write them out. Everything you take in a typical day. Prescriptions, over-the-counter pills, supplements, anything that's part of your routine. Once you have that list, bring it with you the next time you see your doctor or pharmacist. And ask a simple question. Could any of these be contributing to my dry mouth? You're not asking to stop anything. You're just opening the door to a conversation. Sometimes the answer is yes. And sometimes a small adjustment, like changing the timing, the dosage, or even switching to a similar medication, can reduce that overnight dryness more than you'd expect. The second thing you can do is pay attention to your sleep, not in a technical way. You don't need any special equipment for this, just simple awareness. When you wake up, Take a moment and notice how you feel. Does your mouth feel open or closed? Do you feel rested or still tired? If you live with someone, you might even ask if they've noticed snoring or pauses in your breathing during the night. These small observations can give you valuable clues, because if your body is struggling to breathe properly during sleep, it often shows up in subtle ways, long before it's officially diagnosed. And if something doesn't feel quite right, it's okay to bring that up. A simple sleep evaluation, sometimes even done at home, can provide answers that make a real difference in how you feel each day. The third step is checking your blood sugar if you haven't done so recently. This is one of those things that can quietly affect multiple areas of your health at once, and dry mouth is often one of the early signs that something is off. A basic blood test can show whether your levels are within a healthy range or starting to drift. And if they are, the good news is that there are many ways to bring them back under control, through small changes in what you eat, how you move, and how you structure your day. It doesn't have to be overwhelming. Even modest adjustments can lead to noticeable improvements over time. The fourth step is something that sounds simple, but can be surprisingly powerful. Being intentional about hydration, not just drinking water when you feel thirsty, but making it part of your daily rhythm. You might start your morning with a glass of water, have another with lunch, keep one nearby during the afternoon, and then, in the evening, sip a little water over time rather than all at once. It doesn't have to be exact. You don't have to measure every ounce. The goal is consistency. Giving your body a steady supply of fluid so it can maintain balance, support saliva production, and keep things running smoothly, even while you sleep. And then, while you're working on those deeper causes, there are also a few simple ways to make your nights more comfortable right away. For example, you might consider using a mouth rinse or oral gel designed specifically for dry mouth. Products that contain xylitol can help keep your mouth moist overnight and offer some protection for your teeth as well. Using one right before bed can make a noticeable difference in how your mouth feels when you wake up. At the same time, it's helpful to avoid certain things that can make dryness worse. Alcohol-based mouthwashes, for instance, can actually dry out your mouth even more. And beverages like coffee or alcohol late in the evening can contribute to dehydration during the night. Small adjustments, like switching to a gentler mouth rinse or moving certain drinks earlier in the day, can help reduce that overnight dryness. And there's one more thing I want to mention because it's important. If your dry mouth is accompanied by other symptoms, like pain in your mouth, difficulty swallowing, white patches inside your mouth, or unexplained weight loss, those are signs that shouldn't be ignored. In those cases, it's best to speak with your doctor sooner rather than later. Because while dry mouth is common, it should never be dismissed when it's persistent or paired with other changes. Now, if you take a step back and look at everything we've talked about, you might notice a pattern. This isn't about one single cause or one single solution. It's about awareness, understanding that your body is constantly giving you feedback. And when you start paying attention to that feedback, even something as simple as how your mouth feels in the morning, you begin to see opportunities. Opportunities to ask questions, to make small changes, to take a more active role in your health. And the beautiful part is, you don't have to do everything at once. You can start with just one step. Maybe that's writing down your medications. Maybe it's drinking a little more water throughout the day. Maybe it's scheduling a checkup you've been putting off. Each step builds on the next, and over time, those small changes can lead to a noticeable shift, not just in your symptoms, but in how you feel overall. More comfortable, more energized, more in control. So if you've been waking up with a dry mouth, take it as a gentle nudge from your body. Not something to worry about, but something to listen to. And if any part of this resonated with you, I'd love to hear about it. Have you been dealing with dry mouth in the morning? Have you noticed any patterns or found anything that helps? Feel free to share your experience in the comments. Your story might help someone else who's going through the same thing. And if you found this helpful, go ahead and give the video a like. It really does help more people find this kind of information. You can also subscribe to the channel for more simple, practical guidance on staying healthy and feeling your best as the years go on. Because no matter your age, your body still has an incredible ability to adapt, to improve, and to support you when you give it what it needs. Here's to waking up feeling better, starting your day with comfort, and continuing to take care of yourself in ways that truly matter.